to introduce the guest to the audience. Thank you.
Thank you, sir. I request our beloved principal, Dr. Chennakeshavalu, sir, to address the gathering.
Nothing is there, madam. Yesterday I told everything. Anyhow,
Okay.
it's a very good program. So I welcome once again Dr. Prabhu sir. So the useful program in this pandemic situation. Definitely all faculty members, also the students of civil engineering and other mechanical and all other students of second semester should most welcome and let them listen. This is very important. So especially the treatment or any other thing, how COVID-19, everything is going to, I think so. Globally, it's a very good program. So I don't want to take much of your time. Carry on, madam. Thank you very much. All the best for this program. I will also.
Thank you very much, sir.
Okay, thank you.
Now I'll take the privilege of addressing. I'll take the privilege of introducing the speaker to the audience now. So today we have between us Dr. Lakshmi Narayan Prabhu, a renowned and a versatile doctor. Dr. Prabhu, after completing his MBBS, did his master's in internal medicine and further completed his PhD in cardiology. He is a versatile learner and has completed his master's in psychotherapy and further completed and right now he is pursuing his bachelor's degree in law. He is a multi-speciality doctor who has procured proficiency in Sujok therapy and oral medicine, gem medications, batch flower remedies, and clinical counseling. He is a member of prestigious Royal College of Physicians in Glasgow and Edinburgh. And Dr. Prabhu is a voracious researcher, and his areas of interest is the complementary and alternative medicine. He is a part of Indian Institute of Sujok Therapy and Onuri Medicine, an autonomous body to verify and evaluate the efficacy of complementary and alternative systems of medicine in India and to conduct medical research. This actually offers competency-based training programs to individuals and to start a professional practice and treatment of patients. With this vast knowledge, experience, and proficiency, he has conducted various seminars and workshops on ethics, relationships, etc. So he has trained many IAS officers in All India Services Platform for Professional Ethics as well. Sir, on behalf of East West Institute of Technology, I extend a hearty welcome and request you to kindly enlighten us with your talk. Over to you, Dr. Prabhu.
Thank you. Thank you very much, Dr. Radhika. I hope I'm audible.
Yes, sir, you are audible.
Okay. Well, you see, I'm not really used to listening to such accolades because my firm belief is what happened in the past it should be left in the past, and we should look at now and henceforth look towards the future. So the situation where we are today, if one looks at it, you will see chaos, confusion. You know, there is a pandemic going on and people really do not know what to do. So in the midst of all this, I would like to welcome my student friends. And like Dr. Radhika said, I'm also a student of law, though a little late in life, I'm also a student like you. So I hope to add some quality to this 1 hour and help the 81 participants join here, get a new insight into what the situation is. Well, if you really go back to about a year or a year and a half, when we went into college, we would have our own mobiles, our own gadgets, and we would be sitting in the canteen. I mean, more in the canteen, less in the classrooms. But we would be surrounded with friends, and we would be very, very busy with Facebook and WhatsApp and so on and so forth. We had people surrounding us, yet we would be more focused on the digital gadgets. And today, a scenario has come where the only friends that we have are the digital gadgets. We can do a WhatsApp call, we can do a Zoom call, we can do Google Meet, we have Facebook, we have n number of things, and yet we crave for company. Now that's the irony of life, that when we have something, we don't realize the value. Only when we are devoid of it do we realize how valuable companionship is, how valuable friendship is, how valuable sitting next to each other is. So if given an opportunity to rewind back, I would say that I would spend more quality time with people for the rest of my life. So with this introduction and a welcome to all of you, I would like to start by explaining the scenario. Today, Karnataka is in a lockdown, rather most of India is in a lockdown. And why are we in a lockdown? Because we need to be isolated. And why do we need to be isolated? Because there is a virus called a SARS-CoV-19, which has attacked all of us, which is available freely, for anybody to catch. Now, none of us want to catch it. Why? Because we've seen helter-skelter people running it. Hello?
Dr. Prabhu, sorry for interrupting. Your video is off actually.
Okay.
Yeah, I request you to switch on the
Little bit sound also.
Thank you,
madam.
doctor. You are visible.
I'm visible? Okay. I don't know where I am visible, but it's okay. Okay.
Yeah, you are visible now, doctor. Thank you.
Okay. So we have a pandemic that is going on, and that this pandemic is caused by a virus called as SARS-CoV-19. Now let's find out what a virus is. See, we are human beings. We call ourselves so powerful that we can reach out to the moon, we can reach out into space, we can go to the depths of the ocean, and yet, be troubled by a small organism which, 1 million viruses can fit very comfortably on the tip of a pin. And that is something that frightens us today. Let's really look at what a virus is. A virus is neither dead nor it is alive. It's somewhere in between. Okay? It might be lying somewhere on the ground, it might be lying somewhere in an object, and it stays there just the way it is. It only becomes alive when it comes into contact with the host. Till the time it doesn't come into contact with the host, you can pass a centimeter away from that and can still do no harm to you. Now, if you look at the nature of the virus, you will see that medicine does not have a cure, or we don't have a real concrete answer about how to go about working on a virus. For example, if somebody has a bacterial infection, we give them antibiotics. If somebody has got a fungal infection, we give them an antifungal. But for a virus, you really cannot kill a virus. Because by nature, the virus is available, it comes into contact with the host, it does its job, and it leaves. And a simple example for this is the common cold virus, the rhinovirus. What happens? There is a statement which says that negidi bantu andre negidi bandre ಔಷಧಿ ತಕೊಂಡ್ರೆ ಒಂದು ವಾರ ಇಲ್ಲ ಅಂದ್ರೆ 7 ದಿನ. Okay, that's how all viruses behave. They come, they do their job, and they leave. Okay. Now, what is the role of the medical professional? Suppose somebody gets a common cold. What is the role of a doctor here? When you go to a doctor, he doesn't give you anything for the virus. Rather, he gives you something for what the virus does. That means you will have a running nose, you will have a stuffy nose, you will have a sore throat, and that might lead to an infection. So he will give you medicines to suppress the symptoms that are caused by the virus. And in due course of time, you will see the virus will automatically go away. Just as it came, it disappears. Now, what's the speciality with the COVID virus? Okay. Well, there are so many theories about it, and none of it is very concrete enough to tell us what really it is. Some people say it is genetically manufactured, biological weapon, and so on and so forth. Let us not look at the controversies surrounding the nature of the virus. Rather, let's see what this virus does. Like I said before, the virus comes, it does its job, and it goes away. All that we can do is give you some treatment to bring down the symptom. But the problem with the COVID virus is when it comes and when it does its job, it pulls down the human being. It suppresses a lot of basic essential activities of the human being. And many a time when the virus goes away, it takes the patient also with it, and that's the real cause for concern. Now, it's a very multifaceted virus. It can affect anything and everything in the human body, and this is not a well-studied virus in medicine because it is of a recent origin. Okay? The first symptom that we see would be maybe a running nose, a sore throat, some sort of a cough, a small spike in fever like you would see in any other infection. Okay? But then you will see that when it starts progressing, it starts working on the respiratory system, it hits the liver, it hits the kidney, it hits the eyes, and it hits the whole human being, thereby making the human being defunct. And that's where the whole worry is, because we really do not have any concrete plan on how to work with this, despite the enormous amount of research, despite the enormous amount of protocols that are coming into place, which keep changing by the hour. We are still baffled. We're just groping in the dark and finding out the best possible mode of how we can contain this. And that's the reason why we have a lockdown. Okay. The next question is, how does it spread? Like I said, the virus is available everywhere. You touch something, you never know if you've got a virus. Okay. So to avoid the spread of this, the government has put in protocols like, look, maintain social distancing. Why? Because, or rather, maintain social distancing of about 3 feet or 4 feet. Wear a mask. Okay? Don't spit in the public. Okay? Don't throw your food waste into the public. These are some standard precautions that the government has put so that we can avoid contact, and thereby the curve of the virus can come down, and the burden on the healthcare is reduced. If you really look at why this lockdown, the lockdown is not because of the virus. The lockdown is because the whole healthcare machinery is not able to sustain. Okay? The number of patients coming into hospitals, we don't have enough beds, we don't have enough medical doctors, paramedics to take care of it. And if more and more people get infected, then you will see the whole healthcare system will crumble. And to stop that from crumbling, the government has introduced these lockdowns. Now, it's a very sad part, because in this scenario, we have lost a lot of people very close to us, people known to us, people we met a week before, and so on and so forth. We don't know what hit them. They were fine. They were within the vicinity of their homes, and yet, a week later, we found out that they were positive and they passed away. We don't know the exact reasons why. So everybody is looking at COVID with anger. Okay, people look at this scenario as a negative situation where we are losing and only losing. But when I talk to youth like this, there have been desperate times before, and for sure, there will be desperate times in future too. So how can one look at the situation from a different perspective? Can one look at an opportunity here, an opportunity to reach out to the ailing society, to make an impact on the society, to help people who are in need, to be creative, to be constructive, and to be useful to society? If one can look at it from this perspective of how can I be useful to society, how can I help them, then you will see the 1 hour that I'm going to spend with you would be worthwhile. I have a question. Is this going to be a monologue, or would there be a discussion here, or can I ask a couple of questions to my student friends?
Yes, sir. You can just interact with them, sir. I request the students to kindly interact with the guest.
Okay. So, there is a raise your hand here, and if you have any, generally you go to a college, you will see somebody speaking. Most of the time you tend to sleep off. And in an online class, which my son attends, most of the time he's watching video games. Anyway, so let's come back to the subject. I've just told you what the COVID virus is and how it tends to spread, and what the administration has done so that the spread of the virus is limited, it comes down, and the treatment process takes over, and more people recover, and we don't have anybody else dying. On one side, we have the general public who's the most affected. You can draw a triangle and say that it's very difficult to quantify which strata of people are more affected, because everybody is affected one way or the other due to the COVID-19 virus. Okay, if you look at what it has done, what is the impact of COVID on our society? The first one is that the physical health has suffered. Medically, we are seeing people with problems, and you name it, they have all the problems, starting from the simple running nose to the sore throat, to your fevers, to your lung infection, to problems in the heart, to problems in the liver, to problems in the kidney. That's the medical part of it, and then people pass away because of that. There are people who get treatment, there are people who recover also, but there is also a sizable population. They walk into a COVID ward, or they're brought into the COVID hospital, they get treated, they recover, and suddenly 3 to 5 days later, they suddenly have a heart attack and die. Now, why is this happening? Because medically, we are still not very sure about the entire working mechanism of the COVID virus as such. Okay, we're still searching, right? And whatever medication that we have, you open your WhatsApp, you will see that there are 101 prescriptions, there are 101 remedies that are given to you, starting from the simple home remedy to the remdesivir and the plasma therapy and so on and so forth. Prescriptions are flowing, left, right, and center. And though I don't recommend that, at least what it does, it gives some sense of holding on to an information like sort. So physically and medically, we are impacted. That's the first impact of the COVID. The physical health is deteriorating. The second part is emotionally, we are locked up. We have no opportunity to meet our friends. Okay, you cannot even step out of the road, right? A family of 3 or 4 stuck in a room. I mean, I can understand how people your age, 18 and 20, if you're locked up, forget about being locked up for the whole 18 or 14-day period. I can understand how a student feels if he's locked up in a class for 1 hour and the lecture is going to be boring. So you will see there is an emotional drain on the individual. How much can you express? Okay, where is the variability factor here? We just have 4, 5, an immediate family. You cannot have anybody coming to you. You cannot go and visit anybody. So it does take a very strong emotional, it drains the individual emotionally, because we don't have a vent to express our entire gamut of emotions. So emotionally, we are drained. The next part is the cognitive or the thinking part. All that you will have in front of you is the digital god or the internet. And, maybe when you join college, you will have your assignments, you will have to listen to online classes. Thinking factors, if kept in a restricted environment like this, you will see that thinking also diminishes. Because at least I wouldn't like to read 24 hours in a day. And if it's a textbook, for surely not more than an hour. So you will see that even the thinking patterns, they go for a toss. Okay. Look at the social part of it. Like I told you in the initial part, social interactions are cut. We don't have any social interaction now. Even if we meet, we have to maintain a distance of about 5 feet or 6 feet. We need to wear a mask. We cannot shake hands. We cannot give a hug. We cannot share a cup of tea. Okay, because we need to keep a distance, because we don't know who has the virus. We don't know who's going to be a spreader. Okay, the next part is the financial aspect of it. Well, businesses are closed. People are not working, and they don't earn. When they don't work, they don't earn. People with some amount of money, they may survive out of it. But people who work on a day-to-day basis, what do you think will be their situation here? They really are going to find it difficult to even make both ends meet, because there's an enormous amount of financial drain on everybody. All businesses are impacted. We see that the medical industry is making huge amounts of money, but I don't think that this is the right way to earn money out of people's illness. Like I always say, medicine should not be about, or rather any profession should not be about earning money out of people's illness. Rather, it should be earning a decent livelihood out of people's wellness. Okay, so there is a financial burden also. Pocket money would be cut. All right, so the area of spending has also come down, and when you don't spend, you will see there is no circulation of money, and that brings the system to a standstill. Now there is one more part here which I call as the legal part. The administration has stepped in. If you would be observing the news, you will see that there are allegations, there have been corruption charges, there have been people fleecing people, people cheating people, people taking other people for a ride. There has been a laxity in the healthcare system. Doctors have failed, the administration has failed. We don't even get a proper ambulance. An ambulance which would cost you 2,000 rupees, people are now charging you 25,000-30,000 rupees just for one trip to a crematorium. And the law enforcement agency is still inadequate to deal with all this situation. So legally also, you will see that there are chinks and cracks in this in the wall that is supposed to protect us. Now, these are just a few of the things that I could think about, and I've placed in front of you. There will be many more, and as time passes, we will get an exact assessment of what COVID did to our lives. Now, this is all fact, and this is available in the public domain. In fact, much more will be available in the public domain. Now, for the next 25-30 minutes, my focus would be on not to feel helpless, but how can I gain power in the situation and see what best I can do for myself, my immediate family, my community, my society, my country, and my world. So I would like to, throw open the session to my student friends to ask you a few questions. What do you think can be done? What can I do is my first question. I've explained to you how the scenario is outside. Now, given this scenario, if I ask you a question like, what can I do? What would be the various answers that I would get? Let me give you a hint here. The minute I ask this question, what can I do? You can look at it from two perspectives. The first perspective is one of helplessness. What can I do? Look, nothing is in my hand. I'm very powerless here. The big hospitals are not able to do nothing. What can I do? And that's the approach from the point of view of helplessness. Or the second approach should be, what can I do from an inquiry point of view, and generate a lot of ideas and see how you can contribute. So I would like to, open the session up to you to ask you, not from point of view of helplessness, but if anybody can generate thoughts from point of inquiry and then make suggestions on what one can do, that would be really welcome. So can we say, I give you about a minute to raise your hand and then speak. You can unmute yourself and speak.
I request the students, if they have any questions, they can raise their hands and I'll
No, it's Radhika, it's not a question.
yeah, it's their opinion rather.
Yeah, I want to know what their viewpoint. What can I do from an inquiry point of view, from from taking responsibility point of view? If you ask them, what can one do in this situation? What would be the creative thoughts that would come out from these students? Are they shy? Okay. I've still given them a minute, so I'll hold on to that minute before I pitch in. Any ideas, any suggestions, any viewpoints about what I can do to help improve or make the situation better? Any suggestions? I have 71 people in this group. At least if 10% answer, then you would have generated a lot of ideas and food for thought. Okay, maybe students are still shy. So I will come back to this question of what can I do a little later on. But if I go forward, the next question would be what should I be doing? Any ideas on what I should be doing right now? Or the next question would be a little more intriguing. Give us suggestions how we need to overcome. Okay. So look, there are three questions here which I have in mind. The first question from the point of view of responsibility is what can I do? That means, can I be a contributor in this situation? The next is what should I do? What can I do is the power that is inherent in me about what all I can do. It starts by generating ideas and so on and so forth and building it up. What should I do means these are things which I should be mandatorily doing. That means I should stick, I should do this, and there shouldn't be an excuse for not doing it. The third most important question, the real reason for the lockdown is what should I not be doing? Okay? Because this is the most important thing today, what I should not be doing. Because if I ask you, I've already told you what one should do. Maintain social distancing, sanitize, wash your hands, don't spit on the road and so on and so forth. What I should be doing is something that I really know, but what I should not be doing is something that most people don't talk about. We did certain things, and that is the reason why the scenario, we had the second wave, and we are in lockdown. So these three questions, what can I do, what should I do, and what should I not do? I think if we can really find an answer to these three questions, you will see that no matter what the scenario, what the situation is, we will surely overcome this and tide over the situation. Okay? Because what we're really doing right now is we are in a sort of firefighting mode. There is a fire on the right side. There are 100 people who are sick here, 10 people there, left, right, center. People are dying helter-skelter. We're just trying to salvage, we're just trying to stay afloat. This is called as firefighting. Okay, and we want to survive. The minute we deal with the fire, you will see that fire doesn't vanish that easily. It subsides. You have to give it some time to simmer off, go away, cool down, and so on and so forth. And all during this period, we need to survive. Okay? We need to survive, because only when we survive and come out of this, you will see that we will be able to make a further impact. The next part is about, do we have a cure for this? Now, the whole world talks about the vaccine being the magic bullet. Okay? If I'm going to give you a certain input about vaccination, for example, you will see that if somebody gets bitten by a dog, he will go to a doctor and he will ask him for an anti-rabies vaccine. Okay? And that vaccine has been there for the last 25, 30, 20 years at least, more than 20 years. And the nature of the rabies virus hasn't changed. And you will see, he will go there, get his 0, 2, 4, whatever shots he has to get, he will get that. For example, we have a polio vaccine. Okay, the polio vaccine is there for decades together, and the nature of the virus is that it hasn't changed. So we can still continue manufacturing those polio vaccines and continue administering it, because we have studied the polio virus and we have a mode where we can make sure that it doesn't trouble us for the rest of our lives. But that's not the way with a coronavirus vaccine or a flu vaccine. Okay, because in the US, people generally every year they go out and take a flu shot. It might not. It will surely come to India very soon, but in the US it is very very. It's regular. Every year, during a particular season, they go to a doctor and say, "Give me a flu shot." So that year he gets his vaccination and he's fine for the year. So he has to go there every year because these viruses, they mutate, they change, they don't remain the way they are, and that's the reason why these vaccines have to be topped up every year. You don't get a BCG vaccine every 5 years and so on. Once it is given, it is given, because that virus, we have studied it so much and we know how to target it. But for a simple common cold virus or a flu vaccine, you will see that multiple strains are being added every year, and we need to add newer strains into the vaccine so that we are protected from the newer variants of the virus. Okay, so right now, even if we take a vaccination, you will see generally what takes 20 years of research to bring out a real proper vaccine. It has come out in about a year and a half. Well, at least as of now, this is the best bet we have, because people say, look, at least vaccinate yourself. Okay, you will have some kind of protection or the other, so that you will not end up dead. It's not a foolproof method, because people who have taken vaccination have also succumbed. People who have not taken vaccination, they have, the data is so hodgepodge that nobody can tell you that you take this vaccination, you'll be safe. But one thing is for sure, a vaccination is like a safety net. And initially, when the vaccination came into the market, there were a lot of skeptics. There were people who said that the vaccine is going to cause blood clots. There were people who said vaccine causes this side effect, that side effect, you can lose your vision, and so on and so forth. But when the second wave came in and the threat increased, everybody has been rushing towards the vaccine. Now, what is my recommendation to you on the vaccination? I think somewhere we need to trust the administration. Somewhere we need to trust the administrative machinery, the people who run this country. They would not be looking at they would not be looking at doing bad to us. Now, if by policy they have said that, look, vaccinate yourself, it'll keep you slightly safer than the rest of them, I think we should go for the vaccination. Okay? It might not be 100%. What do you say? It might not be 100% sure that it is something like this. For example, if I stand in front of a gun and somebody is going to fire a bullet, if the bullet is going to hit me, then I'm surely going to die. But if I have a shield which I wear, for example, a vaccination, there is a brighter possibility that the bullet will hit the shield. It might cause a lesser damage, but it will still keep me alive. That is how we need to look at vaccination. Okay? So please go get yourself vaccinated. There are different variants which are coming out. Please go and get the vaccination is what I would recommend to everybody. Okay? Now, most important, this is where I would like to make it, this is where I'd like to differ. For most of us who are in our 18 and 20, we have young blood. We are the youth. We are very volatile. We get very agitated. We get very angry. And most of the time, we are rebellious in nature. Okay? And that's the age. We have got our newfound, I see a question here. People, what would be the reason? I'll come back to that. There is one question from a lady called Usha who says, sir, post-vaccination, people have also been infected. What is the reason for this? Let me answer Usha's question. Usha, I don't have a foolproof answer for everything. A vaccination is not a magic bullet. Okay? But it's like a shield. It's like a barrier between you and the virus. Okay? I don't know the intensity of the virus. I don't know the intensity. For example, just imagine I'm standing in point A and there is somebody in point B, let us say 10 feet away from me, and he is going to fire a bullet straight at me, and if there is nothing in between me and the person who fires the gun, I will be shot dead. The vaccine is like a barrier. The vaccine is like a barrier, and no matter what, I mean, if a bullet comes there and this barrier is strong, you will see that the damage that is done to me would be minimized. So a vaccine is something that we hope will not take you into the ICU and will not take you to the morgue. Okay? So that is the only hope that we have. It is not a it is not a foolproof method. Okay? So now, hello?
Sir, sorry for interrupting. Sridhar, kindly switch off your audio. Sridhar?
Thank you, Sridhar. Thank you very much. Okay. So a vaccine is not a foolproof method of telling you that, look, the COVID virus will not hit you. It is one way of protecting you. But since we don't know anything much about the virus, we don't know whether it is a pellet, we don't know whether it is a bullet, we don't know whether it is a bomb, we don't know whether it is a missile, we don't know whether it's got the strength of a nuclear bomb. Okay, and that's the reason why there are people who take the vaccine and still succumb, because we don't know what strain, what power, what variant has hit them. Okay, so we are still ambiguous, we are still confused. Okay, we are still groping, but somewhere, we will reach to a point where we will be on safer ground. But till that time, I want to bring in two aspects here that is called a civic sense. How do we stay alive? Like I said, most of us are rebellious. Most of us, I mean, at least I'm still rebellious. I'm a non-conformist by choice. I don't accept things very, very easily. So I'm a difficult student. Okay? Because I'm somebody who would not like to just blindly obey unless I find out whether there's any rational or truth behind it. But somewhere, I think at this point in time, we need to develop what is called as trust. Okay? So we need to develop what is called as trust. We need to trust the system. And we also need to learn to love the law and to obey the law. For most of us, you will see that we lack in what is called as a civic sense. What do you mean by civic sense? How many of us walk out in the street, throw out a chewing gum there? Most of us do this. Okay, there are kids, 18, 20, they will stand outside the restaurant, buy a teacup, drink that, and then throw the teacup straight out on the street. Why? Because everybody feels this is my country, and if it is my country, I can do anything that I want to do. We have people smoking in the public areas. We have people throwing out garbage in the public area. We have people throwing out chewing pan and spitting out into the public area. And all these, you will see, they are sources of infection, because we don't know who has it. And the minute it is outside, you will see some poor man, somebody without a chappal, or I might slip and fall down on something, and then I might be the host for that new virus to come inside. And this is the reason why you will see that the virus, this is one important reason. The reason is the general public not following civic law. That is the reason why this disease has spread. People stand outside a hospital, they will have a cup of tea, they will smoke a cigarette, they will suddenly spit, they will chew pan, they will chew gutka, okay, and they will spit it out on the street. You don't know who might stamp that. You don't know what that whatever you spit out, what that might contain, and that becomes a very powerful. That's a source for the infection to spread. And if one person catches it, and in the vicinity there are 5 or 6 or 7 or 8 people, you will see that they also will be catching it. So you can just imagine if there is a spread from 1 to 10, 10 to 10 to the power of 10, 10 to the power of 10, it keeps jumping like that, and then one person spitting becomes responsible for a whole community to get infected with the virus. So a basic request, because this has not got anything to do with either being educated or uneducated or literate or illiterate. It's all got to do with learning to love your country. If I love my home, then I'm not going to cause any harm to that home. I'm not going to throw dust or junk or waste here and there. There is a designated place wherein I would throw my banana peel, my used plates and used cup and so on and so forth, because it is my home and I want my home to be clean. Now, if this is my country, why can I not take care of it by, pledging myself that, look, I'm not going to spit on the street. I'm not going to throw waste on the street. I'm not going to smoke in the public area. Can we at least redecide on that? Because everybody is very fascinated by either Singapore or Netherlands or the US, where there are clean streets and so on and so forth. But why not we make the same thing in India by at least obeying the law? Most of us are taught, to be afraid of the law. They'll say, fear the law. But you will see fear doesn't work. Fear doesn't work in the long run. If we really need to change our lives and the future of our country, we should not fear the law, rather we should love the law. Okay? If we start loving somebody, then you will see we will surely comply. Okay? Because when you love somebody, when you love something, when you love to do something, then you will see you will do it with 100% interest, and you will also do it with that much amount of a passion that you will see that things come out very successful. People succeed in love. People fail in fear. Okay? So if there is one thing that you would like to take out, I don't know if you're sitting here by compulsion or by choice, but if you would like to have a better life for the rest of your life, what I would suggest is learn to love the law. And the law is made to help people. The law is there to protect us. And if we destroy those protective barriers, you will see intruders like viruses, bacteria, whether it's an external enemy from across the border, all of them will come because we have failed to love the law. Okay, so this is one message that I would like to give you. Now, I've had a couple of questions like, sir, which is the best vaccine? Okay, very honestly, we really don't know. Okay, we have absolutely no idea about which the best vaccine is. Okay, so whatever is available, go ahead, take that vaccine. Initially, there was only one vaccine called Covishield. Okay, then we had Covaxin. Now we have the Sputnik variation coming in. We have the Chinese variant coming inside. So you will see in a very short span of time, we will have multiple variants coming out. There is nothing like the best vaccine because we don't truly or completely understand the nature of the virus. We are also looking at the virus that is mutating in the second wave. Okay, we have a double mutant, we have a triple mutant that is coming in. Mutation means it changes. Okay, the nature of the virus is that it changes. For example, if you look at HIV, it also changes, and that is the reason why we have not been able to find the cure for HIV. Now, forget, we are nowhere near a vaccine because the virus changes itself, it behaves differently, and we don't know the different types, the different way it behaves, and because of this, we don't have a vaccine for HIV. At least with the COVID virus, it is a little more docile. Okay, so despite its docility, it is still mutating. So there are multiple strains. There was one research that I was reading which said there are 183 different types of coronaviruses available. And we don't have the vaccine for all those strains. So to be very, very honest with you, if you ask me a question about which is the best vaccine, the answer is whatever you get should be the best for you. Whatever is given to you by the state, suppose somebody says Covishield is available, please go out there and get it. Suppose somebody says Covaxin is available, please go out there and get it. Because the question is not what is best. The question is how much of help it can give you. How much of protection, how much of shielding can it give you from the virus. And despite getting that vaccine, the simple recommendation is don't go out. It's okay if you sit at home. Okay? One second, even if you go out, please wear a mask. Please wear a mask. I see a lot of youngsters going out there The mask has become a fashion statement. There is a way one should wear a mask. If Can you see, Dr. Radhika, am I visible to you? Am I visible?
Yes, doctor, you are visible.
Okay, I'm just going to, the mask. Can you see me wear a mask?
Yes, doctor, we can see you.
Can you see me wear a mask? Yeah. See, okay. I'll just demonstrate this to you. The mask should cover the nose and the mouth. Okay. For most people, they will wear a mask like this, like as though it is a chin support and stuff like that. It's of no use. If you're going to do something, let's do that properly. Let's wear a mask in the right way so that whatever we breathe out, doesn't come into the external environment, and whatever somebody else breathes out doesn't get into our system. Hello? Okay. Yeah. Okay. So there is no point in ordering. There's some disturbance. Okay. There's no point in ordering you or compelling you to wear a mask. I think if we need to save lives, masks are the answer. And if you're wearing it, please wear it. All of us should wear it. And if you're wearing it, please let us wear it in the right way so that it offers us the best amount of protection. Okay. And this is how it should be worn. That's the first thing. Okay. So social distancing and wearing a mask. The next is, please don't smoke in public places, because one, it causes harm to the environment. But what I have seen with youngsters is when they smoke, the minute they finish their cigarette, they stub it out and then they spit. And it is in this sputum that you can see viruses can come sit, and they can be transmittable when they come into contact with somebody else. So there are people who are used to chewing pan, there are people who are used to chewing gutka, there are people who chew a gum and then they just openly spit it out on the street. And if we can really avoid that, you will see half the battle would be won. Okay, so that's the second thing. The first one would be wearing a mask. Second one is maintaining social distance. And the third important thing is, please don't litter the street by spitting or throwing waste on the road. I just got a question which said, okay, I just got a question asking, is yoga good? Absolutely. Yoga, pranayama, they are very good. But none of them are really foolproof enough to suggest that just by doing yoga, you can get cured of COVID, or you might not catch COVID. All these are supplementary. Okay. The most important thing are the simplest things, and that is something that we have been told for the last 1 year. Social distancing, mask, not spitting on the road. 3 things if we do, you will see half the battle, 90% of the battle will be won. Beyond that, you want to do your yoga, go ahead, please do it. It is very, very good for your health. It will tone up your respiratory system. It will give you an immunity. It will give you a lot of energy. It will also increase your brain power. Your memory will increase. All that is excellent. But that's not one magic bullet. That's not one magic bullet which will save you from COVID. There is no data which suggests that either Ayurveda. See, the sad part here is we had one spiritual person who came and said, you take this medicine and you'll be cured of COVID. Unfortunately, this is what I call cheating people. Okay, because we don't have any evidence that either Ayurveda or any other system of medicine really has a cure for COVID. Most of them, they will say that, look, this will boost your immunity, this will boost your immunity and boost your immunity. For example, the other day when I walked up to a medical store just to buy some medicine for my mother, there was a huge line which said, I want to buy garlic pearls, I want to buy ginger pearls, and so on and so forth. Because people have said that, look, garlic is good for immunity enhancing pills, and so on and so forth. Just imagine somebody taking in 2 or 3 garlic pills, how much of gastric ulcers it will cause. And then he will land up with a chest pain, and he will not know whether it is because of gastritis or whether it is because of excessive intake of all these, so-called immune enhancing remedies. So don't fall prey, because most of them will induce in you a pseudo sense of safety. I say this, I know this is recorded, and I say this with a sense of responsibility. Please understand that we do not have anything concrete, including the vaccination. We do not have anything concrete to work with COVID. We are just looking at permutation combination. Protocols keep changing. Medicines keep changing. The only concrete thing is to make sure that you're safe. Now, having said that, the second part is Ayurveda, homeopathy, Siddha, Unani, naturopathy, yoga, you name it. I have no problems against them, because each of them are excellent in their own domain. But please understand that they should not instill in you a pseudo sense of superiority, nor a pseudo sense of security, that look, now that you have taken this, you are immune and then you will not be hit by the COVID virus. Please don't be under that impression, because if that is the impression, then that's not the right impression that one should be getting. Okay. What else can one do? Most of us have not one mobiles, but we have one mobile with two SIMs or two mobiles. And what frequently beeps on the mobile? Yeah. What best practice? Yeah. I'll come to that, sir. Okay, I think I will be answering your question. What are the best practices? The first best practice that one can do is to stop spreading false news. Not everything that comes on WhatsApp, not everything that comes in the television channel, not everything that comes on the internet is true. You will see that there are many groups which, I don't doubt the intent. There are a lot of genuine groups. You will see that there's enormous amount of information that is spread. And most of it, 80 to 90% of this information is false news. And we become the harbingers. We become the people who forward these sort of false news and thereby create chaos. Okay? It can be asked, people will say that, look, there are beds available here, go there. Remdesivir is available here. This drug is available here, and so on and so forth. We tend to mislead people. And then we have captions that, look, you take this medicine and this will be taken care of, or you will see that, look, this is the administrative policy. There is more than real news. You will see that a lot of false and untrue news is being circulated, and we are very good at forwarding it, that from one group, it goes out, it comes back in 10 different groups in hardly a matter of minutes. So the first thing is, please stop spreading false news. Ignore the false news. The next part is look towards positivity in life. All of us are enclosed. All of us are within our own four walls. We don't have an opportunity to go out anywhere. Look towards creating positivity. And this is where, techniques like yoga and pranayama will come into help. Yoga, pranayama, meditation, reading a storybook, all this, if you can do that, one needs to cultivate positivity. Okay. The next is, you would be having your own groups. Do something constructive. What do you mean by doing something constructive? Look, I'm a very, very simple man, and I would like to do very simple things. So what do I do? Okay. There are enough and more number of people who are doing service. There are people who are taking bodies from the hospital to the crematoria and cremating it. Forget about religion here. Okay, one. Second, there are people who are helping people get oxygen, genuinely. There are people who are helping people get food. Okay, somebody has tested positive. Everybody in the home is tested positive. There is some need for food. People are giving packed, cooked food, raw rice, and so on and so forth. Okay, what do I do? Early in the morning when I get up, you see, I'm an animal lover. So every day I buy I buy food for the animals on the street. So I go out there and feed the dogs. Okay, I go out there and feed them. At least that's one square meal which they can get, and they also need to survive. Okay, people will say, look, the human beings are dying. You're more concerned about dogs. This is what I can do. Apart from saving lives, this is what I can do. The next is, you can join self-help groups. who are in need of a lot of volunteers, and they will train you into providing specific kind of help and assistance in the group that you're a part of. So if you can join a voluntary group like that and give your time, which is most precious. Money, if I give, I can earn back. But once I give you my time, I cannot get that back. It's yours, it's over, it's given. So if you can join some group like that and then see how you can help, it might be as simple as feeding the animals. It might be as simple as carrying rice from here to there. Whatever appeals to you, please join and do something constructive, that life in all forms are taken care of. Now, most important, please don't unnecessarily medicate yourself. There is one. I mean, this is a common statement which I hear. People will give me a call and say, "Sir, jara mandang aagta hai." People says, "Look, I'm feeling feverish, so I popped in a paracetamol." A very, very humble request to all of you is, please do not unnecessarily medicate yourself. For example, there is a difference. I want you to very clearly remember this, because this is one important point which I get to hear from every patient who speaks to me for the first time. He will say, "Look, I was feeling feverish, so I popped in a paracetamol." And when I ask him or her a question, "What is the temperature?" He says, "Sir, I did not measure it. Okay. I felt feverish, I popped in a paracetamol," which is very, very wrong to do. Please, please, please do not unnecessarily medicate yourself with not necessary medications. It might be a simple sore throat. It might be a just whiff that you felt chill, you felt hot, and so on and so forth. Even before you pop in a simple paracetamol, make sure you check your temperature first. 98.4 degree Fahrenheit is supposed to be the textbook value. But there are people who, at least in medicine, we wait till the temperature goes beyond 99.5, 99.9. 100 is when we should look. 100 degrees Fahrenheit is when we should look for medication. Anything below 100 degree Fahrenheit, please don't touch medication. What is the medication? Yeah, Bhumika will answer that. Okay, so if you are not having a temperature spike above 100, please do not touch paracetamol. You can do precautionary methods, but don't overdo anything. Okay, you can do warm steam inhalation. Okay, you can do yoga and pranayama. Okay, you can drink lots. You can hydrate yourself. You can take one tablet of vitamin C. 500 milligrams of vitamin C is something that you can take, because vitamin C has known beneficial. It has got beneficial properties. So one tablet of vitamin C. Don't pop in 3 or 4 tablets of vitamin C, because there is also news going on wherein they say, "I injected vitamin C and I came out alive." I don't know the validity of that. Don't do anything in excess. Please verify. If you have a problem, talk to your nearest doctor and find out. Talk to him, talk to her. Before you take in any medication, make sure that you really need it. Having fever and feeling feverish are two different things. You might feel feverish for a variety of reasons, but you will have fever for a very different reason. So just because you felt feverish, don't pop in a paracetamol, because what we are doing is we are suppressing that symptom. Let us say at 6 o'clock in the morning, I was feeling feverish, so I popped in a paracetamol. I felt fine in about an hour's time. The action of the paracetamol will last me for about 6 hours. I really don't know what is happening within my body during those 6 hours. Okay, and the doctor will say that, "Look, you can take a paracetamol 3 to 4 times in a day." And without finding out what the real cause of the disease is, if I start popping in paracetamol, you will see I've already lost 2 to 3 days. And by the time the paracetamol will stop working, you will see that, "Sir, the first time I took paracetamol, I was fine for 8 hours. But right now, once in 2 hours is what I need paracetamol." That means the disease has really grown beyond the capacity of paracetamol to help. Dr. Prashant, I see your raised hand, sir. What is your question? People have vitamin C. Look, people have people have started vitamin C. This is all what is called as fear psychosis. Okay, vitamin C, which was available for 3 rupees a strip, today has become 40-50 rupees. Okay, it is good, but then do we really need vitamin C? Do we really need that much amount of supplementation of vitamin C? I don't think so. Just take lime, buy fresh lime, put it in water and then drink that. That should be good enough for you. So supplements are really, really not that essential for all of us to take. We are still young. Okay. I haven't taken vitamin C in the last 45-50 years. Okay, I haven't touched vitamin C, but I've prescribed it to people who need it. But today what has happened is, look, the minute somebody gets up, they will take their ginger pills, they will take their garlic pill, they will take their vitamin C, and with so much amount of medication going in, they will have gastritis, and for that they will also take another medication, and then they keep doing this 3 or 4 times in a day. We are really messing up the healthcare system.
Sir, good morning, sir.
Yes. Yes, sir. Please tell me. I think it's Dr. Prashanta.
Oh.
Hello?
Sir, am I audible?
You are audible, sir. You can ask a question.
Doctor, I have 2 questions.
Yes.
What should be the gap between the first dose and the second dose in terms of days? Okay,
so look, the standard operating protocols keep changing.
Yes.
Initially, when they came out, they said it's a 1-dose vaccine, but then they said no, it is not a 1-dose vaccine. It's a 2-dose vaccine, and it should be given within a span of 28 days, 1 month. After 1 month. Now they have again increased it. Okay, so we really do not know what the exact dosage or what the duration between the first dose and the second dose should be. Initially, when it was, when the Serum Institute of India brought out their vaccine, they recommended to the government that look, it should be at least 3 to 6 months. But then the regulatory healthcare provider said no, it should be 28 days, and so they followed the protocol. There is no clear-cut information. There is no clear-cut evidence on what is the right time between the first dose and the second dose. So in the absence of such information, please follow the healthcare regulations that are provided by the Government of India. Because beyond this, if you look at a biased viewpoint, you will see that we will tend to get lost. Okay? So I think we need to keep ourselves separated from the gossip, from the false news, because we really don't know what is true and what is false.
Okay.
Right?
Yeah.
So whatever is prescribed by the healthcare regulator, please follow that. It might not be the most right answer, but at least right now they have some evidence, and that's why they're making a statement like this.
Sir, my next question.
Yes.
If I took first dose Covaxin or Covishield, the second dose must be the same one, or it may be that.
Yes, because the preparation of that is different. So if you have taken Covaxin, then it is an attenuated vaccine, so we would prefer you to go for Covaxin itself. Okay. The mode of preparation is different. So if you need a booster, see, you want to increase your sugar level, you cannot eat sugar and salt. Okay. Right? You have to eat sugar plus sugar, only then your sugar levels will increase. So if you have taken Covishield, then please go in for Covishield. If you have taken Covaxin, then please go in for Covaxin. Because it's a booster dose. It's a booster dose.
Yes. Thank you, sir. That's helpful. Thank you very much.
Look, people, I think I have another 5 more minutes. I am 50 and odd right now, but I'm still young. I still. Okay. Which is a good mask. Okay. Again, there is no real answer for this, because the medical grade N95 masks are not available. Even when we go into a COVID ward, we don't have access to a genuine 3M N95 mask. Whatever masks we are getting, the so-called white, the conical type masks, they are the industrial masks. Okay, so right now they have gone to a level where there's a lot of some disturbance. Hello? Okay. So please wear a good mask. Like I said, even a towel like this is good enough. Okay? The purpose of a mask is to act like a barrier, right? And the barrier should cover the nose and the mouth. That means whatever from the outside should not get into the inside, from the inside it should not get outside. So any mask which is sufficiently layered, don't wear a flimsy piece of cloth and then say that, look, this is a mask, because it's not going to help you. Let it have at least 2 to 3 layers. Take a towel, close it like this, and let it cover. Okay. Next, when you sneeze, please make sure that you turn to one side and sneeze, because the force of a sneeze is going to take that droplet to a very larger area, and if it remains there as an aerosol and somebody catches it, then the fellow is gone. If one has COVID, so the best protection, there's nothing like a best mask. Something which has got 3 layers, something which covers the nose totally to the mouth and acts as a barrier. That means it prevents things from the outside to getting inside, from the inside to the getting outside. That's the first thing. Second, please wash your hands with soap and water. People today have hand sanitizers. Okay, let's settle for that also. But always understand, no matter what you do, you don't have to be paranoid. Like you see people wearing a gloves. We really don't know why they're wearing it. They're afraid of it. So what they will do is they'll wear a gloves and they will suddenly do this. Can you see me? Can you see me? So they will wear a gloves. They will
yes, doctor, we can see you.
They will touch everything here and there, and then suddenly they will touch their eyes. So they have touched a viscera of their body, and whatever is on the glove, you will see that it has gone into the eye and it defeats the whole purpose. Okay, so most important, whether you wear a gloves or we wear a gloves for a different reason, because we are in contact with body fluids and so on and so forth. Okay, now even if there is a virus on this and my skin is not cut, I touch this. Okay, the possibility of me being infected is very, very minimal, because we don't know whether the virus will survive on this. So what we can do is, if before I touch my ears, my eyes, my nose, my mouth, okay, if I go and wash my hand with soap and water for 25-30 seconds, you will see the virus will dissipate. It's at least better than people wearing a mask, touching here. It's of no use. Okay, so basic precautions, if we follow, I think we can overcome this great difficulty, and we can look forward for a brighter future. I suppose I've completed my 1 hour, Dr. Radhika.
You can continue, doctor. There are some questions also.
Okay, now I will ask Dr. Prashanta to speak, please. Dr. Prashanta has raised his hand. Yes, doctor. Dr. Prashanta?
You answered my questions.
Okay, fine. Thank you, sir. There is Swati who is asking a question. Yeah. Yes, Dr. Prashanta. Hello?
Hello, am I, sir?
Yeah, ask. Please tell me.
Sir, I already asked the question. You
Okay.
answered my questions.
Okay. Can I have Swati? Swati?
Good morning, sir.
Yes, Swati, tell me.
Sir, I have a question that because 1-2 days back, I was voluntarily giving all these waters to the police who have been surrounded here.
Okay.
And I was telling the people to get a vaccination, but they were having one wrong message that if they take the vaccination, they are going to die.
Yes.
Yes, so sir, we, in a social media or any media, so we need somebody to tell that wrong thought. The people who is having that, they are having anybody. If I go and ask, it might be a labors where near my dad. If they tell
Yes,
them,
yes, Swati, you're absolutely right here. Can I ask you a question? It's I suppose you're still 18, 20, 25. You're not older than 23.
No, sir. I'm still 20, sir.
Okay, good, Swati. See, this is where I said one needs to stop spreading false news.
Yeah, sir.
In the first instance, we don't have the correct news. We don't know what is correct. What is correct in the morning will become wrong in the evening because enormous amount of data, enormous amount of research is going on.
Yes, sir.
So the same medication which we said, take it in the morning, a new circular will be issued saying, look, in the evening, don't take this because this has got this problem and that problem and so on and so forth.
Yes, sir.
Okay. The only thing that can save people is when we learn to love the law. That when we stop, if India is my country, then I need to love my country, I need to protect my country, I need to keep my country clean.
Yes, sir.
Okay. If we can do that, you will see that majority of these pandemics will disappear from the face of the earth.
Yes.
Hygiene is of the utmost importance. Okay. So I suppose I've answered your question. Yes, it is true. People have a lot of conflicting views about vaccine because you will see that somewhere in Denmark, somewhere in some corner of the earth, somebody took a vaccine and immediately within an hour he died. We don't know the entire reasons about why he died. Did he have any other problem? Did he do this? Did he do that? We really don't know.
Yes.
We only hear that, look, he took the vaccine and he died.
Yes.
Okay. We don't get, the newspaper do not give us the entire information.
Yes, sir.
Okay. So stay away from false news. That's the first thing. Dr. Prashant.
Sir, one more question is that
Yeah, yes.
my mom, there is one letter with medicine script came, sir.
What?
Sir, medicine script, one script they had been given, had been came in the WhatsApp. It means that the patient who was suffering from COVID, they are going to take this medicine to cure it. The medicines are T between C 500 mg.
Okay. I get your question. These are standard prescriptions which are roaming around in WhatsApp.
Yes, sir.
Okay. Now, look, Swati.
Yes, sir.
If I ask you to give, if I ask you to give somebody an injection, will you do that?
No, sir.
No. Okay. Can you cook?
Yes, sir.
What do you cook? Swati, what's your best dish?
Roti curry, sir.
You make roti curry. So if I come to your home, you'll make roti curry for me, right?
Yes, sir. Sure.
And it'll be good food because you know how to give roti and curry.
Yes, sir.
Okay. So if you and I don't know how to cook, so I will, if I cook and give you roti curry, will you eat that? Will it be edible? I will not know how much amount of salt to put in. I will not know how much amount of pepper to put in. I don't think anybody will even eat that.
Yes.
Okay. Why? Because I don't have a training in cooking. So the first thing, look, it might not sound very right to you, but if you have a problem, please talk to a medical personnel. Or there are so many self-help groups wherein there are volunteers who are trained to answer such queries. For example, if somebody has a sore throat, that sore throat can be bacterial in nature. And that sore throat will go away just by gargling. If I do a saltwater gargle, it will go away. If I do a Listerine gargle, it will go away. If I do a betadine gargle, it will go away. But I immediately press the panic button. Oh, gantal katta bantu, negadi bantu. COVID bandide. Go get yourself an RT-PCR and so on and so forth. No. Please do not press the panic button. There are still sane people, there are still sensible people available who are genuinely willing to help you. Wait and watch. And when you're waiting, follow all the precautions. Very simple. Social distancing, masking, washing your hands with soap and water. You follow that precaution, and still when you get it, do simple remedies. Don't say, I will take 2 tablets of vitamin C, I will take 2 tablets of, I will drink kada and so on and so forth. You might not even need that. You take more of ginger. There are people who are taking ginger juices and suddenly in the evening or in the night, they give me a call, there's a chest pain. And then I have to sit and talk to them for half an hour. What did you do? Sir, I took 4 glasses of ginger juice in the morning. That has caused a lot of gastric irritation, and that is why they're having a referred pain. Okay, so don't get into a false sense of safety that, look, this or this or this or this is going to, keep you immune from anything else. No, it's not. The only thing that keeps you safe is all that the precaution that I've told you. You follow the precaution, that is more than sufficient. Don't walk out into the street, that is more than sufficient. Don't spit on the street, that is more than sufficient. Don't stand outside and have a cup of tea because you don't know what is floating in the air and you might catch that. If you follow civic rules, then you are safest. Okay?
Thank you, sir.
Dr. Prashanta, sir, I see your raised hand, please.
Doctor, I have a question.
Yes, Dr. Radhika.
May I?
Please, yes.
Sir, what precautions need to be taken for the patients who have already faced COVID? I mean, they are negative now, but still some of them are feeling very tired and
Yes.
many issues like that.
Yeah.
So
See,
what is
these are called as post-COVID syndromes. We saw them spike up after the first wave, and now it has died because the second wave has taken over. Okay.
Okay.
So since we really don't know what all the virus does, where all it has an impact, okay, we cannot predict which part of the body the virus has hit and what trouble we will face. People have been having neurological problems. That means they lose their memory, they're not able to walk. It hits every part of the body, as far as I know. Okay, and it's very difficult to tell you which part will be hit. So the very simple statement: people who have had an infection of COVID-19, either first or second, and have recovered. Okay, first is give them ample amount of rest. Give them ample amount of rest, because in the hospital you would have bombarded them with steroids, with unnecessary medication. You would have elevated their sugar levels. You would have suppressed their immune levels. You would have suppressed their allergic reaction. You would have done a lot of things just to make sure that we get them out of the crisis and bring them back into life. So when you get out of hospital and you come home, the first is good amount of rest. Both physical rest and keep them happy and jovial. Okay. We will rebuild our life back. You've crossed through a great barrier. You've come out of it. Thank you. Good. You're a fighter. You won. Come back. First, make sure that the person gets adequate amount of physical, emotional, and mental rest. Second is good amount of hydration, fluids. Okay. Drink good amount of fluid. Hydrate yourself. Hydrate yourself. Hydrate yourself. Because the amount of medication that we pump in 3, 4, 5 times in a day, that itself is enough to knock the body down. So all that needs to be flushed out of the system. So hydration is a must. Okay, there are two places where one should restrict water. If somebody has got kidney failure and heart failure, that's the only time you need to monitor or restrict your water intake. Otherwise, good amount of hydration. Third is good high protein nutritious diet. Because the individual is going to feel very, very weak. So give him, whether it is vegetarian, egg, white, non-vegetarian, whatever, give them good amount of high protein nutritious diet. And I think the body will bounce back to normalcy.
Okay.
There's nothing special in this.
Thank you, doctor. There is one more question from a student, doctor. It reads as follows. After vaccination, there are some changes in the body, that is fever. Is it good or bad? Can you tell me the reason, sir?
Yes. Look, what is a vaccine? For example, there is a virus. Let me talk about the attenuated vaccine which we've been using for all these years. There is a virus here called as COVID-19. What we have done is we have got this strain into the lab, and we have taken the genetic material out of that. Okay, that means we have made, if the virus enters into the body, then he is going to create havoc. What we have done is we have taken it is something like the nuclear material is taken out of the bomb and only the shell is introduced. So we have made this virus impotent. Attenuate is what we call. We have made him impotent. He cannot replicate. He cannot do anything bad to the body. He cannot knock an individual. He cannot kill an individual. So this impotent fellow, we have reduced his strength to such a large extent that when we introduce him into the body's defense mechanism can detect him and fight him and destroy him, so that the body generates its own level of immunity. So I mean, the body doesn't know whether it's a full virus or a half virus or an impotent virus or just the shell of it that is coming in. The body only knows that some intruder has come in and I need to fight that. And the minute the immune system of the body starts fighting the virus, the first thing that we will see is it mimics a sort of semi-COVID symptom. So whatever symptom COVID is supposed to give you, when you introduce an attenuated type of vaccine into the body, it also mimics it, but those are going to be self-limiting. Those are not going to get across to a full-blown infection. So you will see that people will feel feverish, but that will be taken care of by paracetamol. You will see people will still have a sore throat, and you do some Listerine gargle or betadine gargle, you will see it will be taken care of. So the vaccine tends to mimic the infection, but not to an extent so as to cause damage to the individual. So this is why post-vaccination generally you have fever and body pain. It mimics the disease.
Okay. Any more questions from the audience?
I have Yamuna who has raised her hand.
Yes, Yamuna, you can.
Sir, can you tell us how to maintain oxygen level in the body?
The best way to maintain oxygen level in the body is to sit in front of an oxygen cylinder. Okay, lady. Okay, that was a joke. There is ample and adequate amount of oxygen in the body, and that is why we are living. Normal breathing itself gives us enough amount of oxygen. But if you can do yoga, if you can do pranayama, okay, or if you can do some physical exercise, you will see the rate of respiration will increase, and thereby your body will be hyperventilated. Okay, so the more you breathe, for example, if you do certain types of pranayama, the amount of inhalation, exhalation that you do, it automatically increases the oxygen concentration, the level of oxygen in the body. Okay, so if you go back to age-old practices like exercise, when you start running, you will see you breathe faster. You do some exercise, you're burning calories and you're breathing in more air. So you will see oxygen saturation tends to increase. Okay, deep breathing. I mean, I don't want to attach any religion to that. Deep rhythmic breathing is one way where you can, maintain oxygen levels, and that is not just good for the lung. It is also shown to invigorate brain cells, and deep breathing will also help you increase your memory, something which you will need for the next 2 or 3 years to pass your exams at least. Okay, so that's about it. That's how one looks at oxygen concentration in the body.
Yeah. Thank you, doctor. And any more questions from the audience?
Thank you, sir.
Sir, one question.
Yes, sir.
Sir, many states they are imposing a night curfew. How
Yes.
it is going to this viral infection, sir?
Sir, you will see that these are just administrative decisions. The virus doesn't differentiate between whether you're white or black, rich or poor, politician, BJP, Congress, JDS, Tamil Nadu, Andhra Pradesh, Karnataka. It doesn't differentiate. Okay, but when you look at administration, there are certain reasons on which policies are based. If you look at the statistics in Bangalore, you will see that the CBD, the Central Business District, is the area wherein the maximum amount of infections are being found. So they would have a policy which will say that, look, people crowd into bars and pubs in the night. Okay, they would have seen that, and then they will say that, look, if we impose a night curfew, at least people coming here will be reduced. See, these are just firefighting solutions. I'm sorry, that's not the way I would like to put it. Okay, but just because it is hot, I'm putting some water on that, and it's just firefighting. The fire will come out elsewhere. So this is an administrative decision based on certain data that they have received. Night curfew, people go out into the bar, people go out into the pub, people go out to these places. So you restrict all their activity after 9 o'clock. Okay, and then you will see that at least those incidents from where the spike could increase, that comes down. So that would be a reason why they would have imposed either a night curfew or a Janta curfew or a lockdown. These are all administrative decisions. But very honestly, if all of us obeyed the rules, loved the law, and followed, our life would be very, very normal. If we all wore a mask, if we didn't spit on the street, if we maintained our social distance, 4 or 5 things if we had done, we would not even have reached the second wave. India had won this. Then people have said that, look, you had the Kumbh Mela, you had the elections. So there are so many things. Let's not go up to that level. As an individual, if I do what is within my capacity and I do that honestly, you will see each one of us can defeat the disease. It's very, very easy to do that. We don't even have to be afraid. We did not follow what was required for us to do, and that is the reason why we are stuck here. There is no point in blaming anybody. Yeah, everybody has got a part to play. But if I find out what I can do and do that, then you will see my job is done. I can only hope and pray that all of us follow the rules, the law, and overcome this pandemic. I hope
Thank you,
that answers the question, sir.
Thank you, sir. Thank you.
Thank you, sir. Gupta, sir, can we conclude? Principal, sir?
Principal, sir.
Yes, madam, go ahead. Really, it's a very so in detail. The doctor explained very well in detail from beginning to end, and I really answered all the questions posed by the students and the faculty members. So really, all are knows what exactly what is happening and all. Really good, sir. The doctor spent his valuable time with us 1.5 hours. So really, it's beautiful. Thank you so much, sir, for your this one.
Yes, sir. Thank you.
Leadership and everything. Thank you so much, sir. Go ahead, madam. Thank you.
Yeah, thank you, sir. I request Mr. Sunny, Assistant Professor, to render the vote of thanks.
Yeah. Good afternoon, everyone. It is my privilege to render today's vote of thanks. I, on behalf of EWIT, Department of Civil Engineering, first and foremost, I would like to thank our today's speaker, Dr. Lakshmi Narayan Prabhu, sir. It was a very important and helpful session for this pandemic situation. And I also thank Doctor for enlightening us as we got some clear picture about COVID-19, as most of us were misled with the rumors. And also, I would thank you for answering all the queries regarding variant marks, vaccinations, etc. Thank you, Doctor. I also extend my gratitude to our HOD, Dr. Nagaraja Gupta, sir, and Principal Chennakeshavalu, sir, for providing constant support in organizing this webinar. Also, I would like to extend my gratitude for the backbone of the program, Dr. Radhika K N, for organizing this helpful webinar. Last but not the least, I thank all the listeners and the attendees for supporting the program. Thank you.
Thank you very much, sir. So we have come to the end of the session. Once again, I would like to thank Dr. Prabhu for such a very informative session and sparing his valuable time. Of course, 2 hours is a time where he has given the lecture, but the preparation and thinking process and all would have probably taken more than 3 days to him. Thank you so much, sir.
Thank you. I hope I've been useful to people.
It was indeed very useful, sir.
Right.
People from East West Institute of Technology would like to have a continued interaction with you, sir.
Yes, madam. If I can be of any use, I'll be always there. Right.
Thank you so much, sir.
Thank you, ma. Can I log out now?
Yes, sir. Yes, sir. Thank you so much.
So thank you. Take care. Be safe and be healthy.
Thank you very much.
Thank you. Thank you for all the audience as well.
Thank you, sir.
Thank you.